We have a safety alert. South Carolina has the highest flu activity in the country. And there's a map on the CDC that says actually we're in the purple. So we are very high up there in our numbers. And we do wonder, why do we have so many cases? How can you protect yourself? So I'm here with Dr. Nita Bajor. She's a family physician at Oakview Medical Associates. Thank you so much for joining us today.
Thank you for having me.
Yeah. And what are you seeing in your practice so far? Are you seeing a lot of people come in?
Yes, we're seeing a lot of flu and a lot of influenza-like illnesses where it's actually not COVID, it's not influenza, but all these other viruses are also mimicking flu-like symptoms. So.
And why do we think the numbers here are so high? We actually have a full screen. I want to show you that there have been about 30 deaths from the flu, 2,098 patients hospitalized, and over 20,000 cases just here in South Carolina.
Yeah.
So why do you think it's so high here?
Well, I think overall two main reasons. One is viruses evolve, they mutate. So the vaccines are based on the circulating strains for that season. But, viruses are very smart. So if they're changing their genetic profile, then the vaccine is not that effective. I think that's one reason, because they mutate very rapidly. And the other one is because of the lack of immunity overall. Since COVID, we've had, people have been under lockdown, so our inherent immunity has not been that strong. And now every year after year, you've noticed we've been socializing much more and going around much more. So I think it's going to take a few seasons for us to build that inherent immunity or the native immunity against viruses.
So. And you brought up the vaccine. How effective is the vaccine this year?
Yeah, so the vaccine overall, I think, is about 40 to 60% effective. Although it might, not get everybody and people will still get influenza, it does help reduce the severity of symptoms, and it definitely reduces hospitalizations and deaths. So it's still effective in that regard, but overall it's not as effective in preventing just general flu in the population.
But we do think there's some variants out there that, it's not protecting against.
Correct.
And maybe that's why it's so high here.
Yeah.
So, okay.
Yeah.
Now, what should you do to prevent getting the flu?
So obviously vaccination is our first line of defense. Also hand washing, covering your, just masking up if you have active symptoms. If you have symptoms, stay home and just get the rest you need. Sanitary practices are very effective. If you're sick, do not go out and into social circles, because you'll spread it to many more people. So those are the things we can do to prevent.
And then what about treatment? I know Tamiflu is one I've heard of.
Yes.
Are there other treatments
There
as well?
are. So antivirals are pretty effective if used within the first 72 hours. They shorten the duration of symptoms. They don't really kill the virus, but they help you get back to...
But do it right away.
Yes,
Yep.
right away. Seek your physician's care immediately. Then there's also supportive care like rest, hydration, good nutrition, and just taking, medications like acetaminophen just to reduce the fever, keep you comfortable, and also reduce your body aches and pain overall. So.
All right. Well, thank you so much for joining us today. And yeah, we'll continue to update people on those flu numbers. But yeah, high activity here in South Carolina.
That's right. Thank you.
And now.